Hi all and welcome. As we know, this month is Breast Cancer Awareness Month, and we're here at Cleveland Clinic Abu Dhabi with some of our medical professionals to get insight into their expertise and to go into some crucial conversations around healthcare. My name's Catherine Thomas and I will be the host for today. I'm Assistant Nurse Manager in the Oncology Infusion Centre in the Fatima bin Mubarak Centre here. So today's topic is going to be mainly about breast cancer screening and awareness, what it means to you as a patient and what you can expect during your journey here at Cleveland Clinic Abu Dhabi. So I'm lucky enough to be here with two of our experts. I have Dr. Zabair Ahmed, who is one of our primary care consultants here, and I'm also here with Dr. Maria Ansari, who is one of our medical oncologists that is an expertise in breast cancer. So I guess let's get into some questions, but first, welcome guys.
Thank you.
Thank you.
So let's just go back to the basics. Dr. Zabair, how often would you say that a woman should get screened for breast cancer?
Thank you for that question. I'm happy to be here. I think when we look at screening, we need to go back to the basics. Early is better, and that's what we want to do. And so if we can diagnose earlier, the options are better, the prognosis is better. Mm-hmm. And with breast cancer screening, we want to pick up on the changes before you even develop a lump. Because it may not be easy to feel a lump. Imagine, a lump has to be of a certain size before you even notice it. And let's face it, life is busy, you've got children, you've got family, you've got work. Even though we recommend self-examination, you may not have the time, you may not be able to do it properly, and you could easily miss a lump, and a few months might pass and then it might become a bigger problem. And so the aim is that we can notice the little changes before even the lump develops. And the recommendation by the Department of Health is to have a mammogram every 2 years from the age of 40 all the way to 70.
Mm-hmm. Okay, great. And I guess that kind of adds into the question about how often women should be screened for breast cancer, as you were saying.
So obviously every country has its guidelines, and we follow our guidelines from the Department of Health, and it starts from the age of 40 all the way up to 70. But there are some little nuances, because if you have symptoms, that's totally different. That's not screening. You may need to have investigations earlier, and you may need to be referred to the breast clinic and to have more specialized tests. Or if you have a strong family history, so for example, if you have sisters, and men sometimes can have breast cancer as well, then that might put you at an increased risk. So you might need to start breast screening even earlier, even before the age of 40. And in some instances as well, depending upon the density of your breast, we may actually recommend more earlier screening. And there's many guidelines and societies out there which are recommended for annual screening for this very reason, because in women, particularly in the younger years, their breasts can be a little more dense, and it might be harder to detect the changes earlier on. And remember, the aim of the game is to detect things early, and so I think that's when some recommendations recommend annually.
Okay, thank you so much for that.
So that's a wonderful explanation that Dr. Zabair has just given. I recommend an annual screening for my patients, and there's a reason for it. There are certain advantages that we see. In this country, in this region, we also tend to see younger females that are diagnosed with breast cancer. And in my experience, catching those cases earlier, as Dr. Zabair also mentioned, is much better for them. The modality of treatments that we use become less when they are found at an earlier stage.
Mm-hmm. Okay, thank you so much. And Dr. Zabair, what can a patient expect when they come to see you during a breast cancer screening consultation?
So there's many steps involved in screening a lady for breast cancer. Often we think it's just a scan, but you need to break it down. So first we start off with a history. So we check if she's got any symptoms, and common symptoms might be obviously a lump, persistent pain, changes to the skin of the breast, or even a nipple change, and obviously any worrying discharge. If there are any of these symptoms, often it warrants a referral directly to the breast clinic to see specialists like my colleague Dr. Maria, and then she will then create a more bespoke investigative plan. But if you don't have any symptoms, okay, so that's the first step, then you will be eligible for screening. We then move on to family history. And particularly we look for any first degree relatives, so in the immediate family who've had breast cancer, particularly before the age of 50. Because if there are certain members who fall into this category, it kind of raises a suspicion there could be a genetic component. So rather than being environmental factors, like obesity and other metabolic disorders causing the cancer, there could be a genetic component, which I think we'll be talking about in detail later on in the podcast. And if there is a concern, in addition to screening, we often then refer you to our high-risk cancer clinic, where you will be assessed by our colleagues for any genetic risk of breast cancer, as well as any associated cancers. So sometimes cancers can be linked together. At this point, if deemed necessary, the lady would also be offered a clinical breast examination to inspect the skin, the nipple, and see if there's any obvious lumps to feel. And after this process, we move on to the mammogram.
Yeah, so leading into the mammogram, I know that there's probably some misunderstanding around it, and it can be scary at times for patients when they think about it. Can you walk us through how the mammogram works and what the patient should expect?
Absolutely. Lots of people hear all this fear about the mammogram, and the word sounds pretty scary as well. But essentially, it's quite a quick process, and I can't envision it being anything more than 10 and 15 minutes in total. Usually, you'll have an appointment in our radiology suite where you'll be welcomed by a radiographer. They will ask some screening questions, so there's some contraindications. So if you're currently pregnant or you're breastfeeding, then we tend to delay the mammogram because that can affect the interpretation. So certain kind of simple questions will be asked. You will then stand in front of the X-ray machine, and each breast will be examined one at a time. And I think this is where the fear comes in, because obviously each breast is placed between two plates, and there's a gentle pressure applied for a few seconds, and I must stress it's only a few seconds. It's not supposed to be painful. And then a detailed picture, or a detailed specialized X-ray picture, is then taken of each breast. And that in itself, the actual time when the X-ray is taken is just a matter of seconds. And then after that, it's completed, and then obviously the images are sent away for our specialist radiologist to then interpret.
Okay, thank you so much. And Dr. Maria, I know that sometimes that people worry that the mammogram might cause cancer or make it spread more. Is this true?
It's a very common myth, but the answer is no. Mammogram does not cause or spread cancer. In fact, the benefits of a mammogram and the screening and picking up cancer at an earlier stage far outweigh the minimal risk that we have with radiation, and also the discomfort that patients feel. I think the way Dr. Zabair has just explained is excellent. It's just a compression between two plates, which can be uncomfortable for some patients, but it's not supposed to be painful per se.
Yeah, thank you so much for that. And just say someone doesn't want to have a mammogram for whatever reason, or they're unable to, are they able to get an MRI instead? And is this enough for screening purposes?
Yeah, so an MRI is not a substitute for a mammogram, but there are certain caveats to this statement. An MRI can be used for certain situations in women who are younger than 40, who have genetic mutations, and they are put on a surveillance program, or say women younger than 40 who have had childhood cancers and have been exposed to radiation, or the lifetime risk of breast cancer is very high because of other genetic mutations. So there are caveats to when we use an MRI versus a mammogram.
Yeah.
But it does not substitute a mammogram for the general population of women who are not at a higher risk for breast cancer and are just undergoing screening by virtue of having this organ and also by virtue of age. So at the age of 40, they're supposed to get the mammogram, but they have no other risk factors with it. An MRI can also be used as an adjunct to a mammogram when they are, say, being followed in a high-risk genetic clinic like we have at Cleveland Clinic, Abu Dhabi. And those patients are on a certain protocol where they can be screened with a mammogram and an MRI together, but placed at different intervals as well, based on their history.
Okay, thank you so much for that. And what if women have breast implants? Is it still safe to do mammogram and MRI?
Absolutely, and just having implants does not take away, the reason for getting screened. An implant is just an addition to the breast. There is still breast tissue which needs to be screened.
Yeah. Okay. Thank you so much for that.
Dr. Zabair, what do you think about?
I totally agree. It's one of the common questions, and we get in primary care because the ladies are often saying, "Oh, obviously I can't have a mammogram." They're concerned about the compression of the plates, but I've referred several ladies and no harm. They've not come to any harm whatsoever. And the worst thing is you don't want the wrong information going out there, and just imagine if you had this information and you never got screened and later down the line it turns out to be something, you don't want to be in that position. So we can't stress enough about this point. There's very little contraindications for mammograms, so people shouldn't be concerned about it.
Thank you very much. That's very informative. And Dr. Zabair, can a lady have a mammogram if they haven't felt a lump as of yet?
Absolutely. And that's going back to the first point. You shouldn't wait to feel a lump. You should get screened when you're eligible. Because, like I explained, a lump has to be of a certain size. Imagine if something's a centimetre, okay? Are you going to be able to feel that when you're self-examining? That's just the end of your little finger. Yeah. Probably not. You would miss it. And then you would leave it for another year or maybe longer until it becomes bigger, and then it might be aggressive and you may have missed out on some of the modalities of treatment. So don't wait until you feel something. If you're eligible, please come. If you've got symptoms, please come. We'll work out the best screening for you.
Thank you so much.
So I think that's put very well by Dr. Zabair, that we don't have to wait until a lump is felt. The whole point of screening is to pick up any changes in the breast prior to there being symptoms. Yeah. So a healthy, young 40-year-old female and above should be getting screened no matter whether they feel any changes or not. Of course, I tell my patients, be aware of your body and be aware of any changes, but screening is not meant to be with any symptoms. It is just to see if there are any changes in the breast over the year. Another thing, and another very important point here also would be that precancerous lesions, which then can convert into cancer, also are picked up by the mammogram, and they can be easily treated. They may not have the time, if we picked it up early, to proceed to becoming cancer. So that's where screening becomes so important. Precancerous lesions may not be felt as any lump or any changes in the breast.
Yeah. So thank you both so much for joining us today and for your insight into this topic. Do you have any final thoughts or advice for the listeners to wrap up the podcast?
Sure. The key is the earlier is the better. And so if you're eligible, don't hesitate to come. At the very least, have a conversation with your primary care physician. They're usually the first point of care. You don't have to make a decision on the day. At least make sure you're getting the right and the correct information so you can make the best decision for yourself. And then once you're more informed, you'll understand this is all in your best interest.
Prioritize your health and get screened. Screening saves lives. It's really important to empower yourself with knowledge and go ahead with your screening.
Thank you so much.